Since I was talking about my flare the other day, I had a few questions that came in about my vlog. So I figured I would talk about, I have multiple things going on. I have rheumatoid arthritis, I have multiple sclerosis, I have intracranial hypertension, I have POTS, and I also have another autonomic issue, and then all the crazy stuff that goes along with all that stuff, from meds and things like that. So I have quite a bit going on, but I thought I would talk about the MS stuff today. 1 and 2 and 50, because it's what's kicking my butt right now. I'm super close to my infusion for MS. I get an infusion of medication called Ocrevus every 6 months. Brain fog and cognitive issues are definitely a thing with the MS. I actually had to go through last November. I was talking to my nurse advocate from the insurance company, and he actually ended up having another nurse call an ambulance because he didn't want to get off the phone with me because I just wasn't mentally functioning. I wasn't making sense. Things that I could discuss 100 times over, I can't even remember what they were. So I had to do cognitive testing, which, despite what has been in the news the past year, it is not some little 10 question test you take. Cognitive testing is 5 to 7 hours of testing. You go through multiple tests. You have written tests, you have verbal tests, you have computer tests, you have some that are on the computer, some that are on paper. You have multiple. When you do cognitive testing, part of what they're testing is your executive function, which I've started to have issues with. I studied law in college. I could take a list verbally of 20, 25, 30 items, keep it in my head and recall most of it. Now, I have trouble recalling anything more than 3 or 4 things. I definitely, I could organize them in my mind and shoot them back out in different groupings. I have tons of trouble with that now. So I have to do different things to keep, to work on the deficits that I now have in executive function. I also have what they call depression that doesn't present as depression. So that's fun, because I've been through tons of mental health testing and everyone said there was no depression, but now the cognitive testing is like, no, you have depression, but it doesn't present outwardly as depression. So that's a fun thing. With the MS, the biggest issue that I have is I will lose on my right side. I will lose mostly on my arm, but I do get it on my left side, not my right side. I think I just said right. I'm having a lot of other issues on my right side right now for other reasons, so I'm so used to saying right, I think I just said it again. That's another thing between the MS and the IH, is I replace words with things that don't make any sense. I've been live streaming and I can mean to say door, be looking directly at the door, and I will call it tree or car or something completely different in the course of a conversation and won't realize it. When I'm really bad, I will text, or even if I'm just Googling something to look it up, I will type it out and I get frustrated because Google doesn't know or someone doesn't understand what I'm saying in my text. And I am seeing what I think that it says, but then it's like the brain connection isn't working correct. And what I type out is a complete jumble that makes zero sense. That's been happening for a long time. Another question, oh, well, I guess we can go back. So I lose feeling a lot in my left arm, which before I was diagnosed, I had for 90 days, and I had multiple doctors all tell me, including, it started around just before an ER trip. Everyone just kept saying, oh, well, nothing's come up, so don't worry about it. I don't know how you don't worry about your losing feeling in your arm. I can move it, but I can't feel it. And I had no feeling in it for 90 days. And they're like, oh, well, you know. No, I don't know. It doesn't seem like it was right, and it wasn't. Another question. Oh, symptoms. I also trip a lot, but I also have POTS and autonomic issues, so I pass out a lot. So it's a combination of passing out from the autonomic issues versus falling from the MS stuff, which is sometimes hard to distinguish which one it is. I've started having issues when I'm really bad. I will have problems with walking into things that aren't on the side of the room that I'm supposed to be on. Like I'm just keep missing that connection. I had a question about when I was diagnosed. I was diagnosed officially in 2018. However, 5.5 years before that, I was positive for the bands for MS in my CSF when they did an LP to try to relieve some of the pressure in my head. They tested it because they were concerned. They were having trouble. I was in the hospital for 3 weeks, and they were having trouble determining why my numbers were the way they were. So we did an LP to immediately remove some pressure and take off fluid, but then they tested the fluid. And no one actually told me. I saw it in my records a few months later. And I Googled it because I didn't know what that test was. And I remember asking my primary and my rheumatologist, and they're like, oh, well, if you don't have symptoms, don't worry about it. So I had my first IH shunt, which ended up being removed. It was put in September, but then it was removed the next July. So it wasn't even in a full year. I had a lot of issues with the first shunt, and when they removed it, I actually don't remember the 2 weeks before, and I had a change in head pain. I actually lost all of that time. I woke up from my removal surgery thinking it was September, and we had just put the shunt in. And then people kept telling me that it was a different time. And I started remembering things like I have a niece who started some treatments, and I remembered that, but that couldn't have happened if what they were saying wasn't true, because I knew that was after I'd had a shunt in. So as the memories came back, it started to make more sense. But I lost the 2.5 weeks before. Those never came back before the removal. So I went to my POTS specialist, and my head pain was so off. And because I couldn't remember where my head pain was in that 2 weeks, because I had a change of head pain, but I didn't know where it was and what it felt like. And she doesn't go to main campus that often, so she's like, look, I'm sending you for an MRI. People can give me evil snares in the walk in the hall, so like I go to main campus once a year, sometimes twice, to be on call. So I really don't care, but I'm not comfortable with not scanning. So I went for an MRI, and that I had an MRI the December before, and that was in July, the very end of July. And they didn't, between December and July, I had weird signals that started coming up on my spinal, in my cerebral spine. So I went back, and there were multiple other lesions, like as they scanned down further, and then they saw the same kind of weird signals. They didn't keep scanning all the way down because right at the edge they saw the same type of weird signaling, but it was the same as they had at the top, so they were comfortable with the fact that it was probably a lesion also, without going through yet another MRI. And then by the time I got to the MS neuro, he found where there is a lesion also in my head, but because I've had so many surgeries on my head between the shunt, the revision, the other side of my head, I have burr holes from pressure bolt trial. So there's so many different things going on that unless you know exactly what you're looking for, it can be easily passed up. Because the first time I saw it, I didn't notice anything. He had to show me the scan, the MRI, multiple times and let it play and then pause it and show me right where it was. Because that first set of MRIs, it was a blink and it was gone. You didn't see it anymore. You had to sit there and probably go frame by frame to thoroughly see it. That's how I ended up being diagnosed. Like I said, I had the 5.5 years before. I was positive for bands, but my doctor told me not to worry about it if I didn't have any symptoms. But by the time I went and talked to the MS neuro, he's like, why didn't you? Why haven't you been here yet? We could have been doing treatment. And I'm like, they said that not to worry about it. And because I also have RA, and a lot of the meds between them can be sister meds or overlapping meds. So that was probably what was holding off of some of my MF symptoms for a long time were my RA meds. Especially when I was trying different biologics. What else do we have? Most of the questions I got were overlapped. Ba, ba, ba. I had a question about what MS really is. It is treated in the autoimmune family of doctors. Like I see neuroimmunology, but it's an immune issue, and it's how your body, your immune system reacts to a certain protein. I'm really bad at explaining it. But it attacks the protein, this protein, like it is an invader. In the same way that my RA, my immune system attacks my joints, it can attack where like an organ attaches to something or like a bone joint. That is how your immune system in RA attacks things. In MS, it's attacking a protein, which causes the breakdown in the sheath. That's why it's not necessarily autoimmune, but it is immune related because it's an immune response that you're getting, but it isn't. That's that gray area where not everyone puts it in the autoimmune family, but it is an immune issue. The inflammation that's caused when it attacks the myelin causes damage to it, and you have breaks where there are the lesions. You have breaks in the blood-brain barrier, which means it's easier for things to pass through it and become an issue. In my case, I have to watch. I'm very limited on meds I can use because my JC virus level is high. So I am already, without using the meds, I'm already at a higher risk of getting PML, and I can't say the long name of it, but it is a brain infection. And some of the MS meds have a higher instance when you're on the meds of getting that. So any of those meds I'm already not eligible for. But there's 3. One is a med that I've actually tried for RA. It's something that's used in both of them, but I came off of it because I started that at the same time I was on something. I had started something else. I had a bad reaction in my system, so they pulled me off both meds, and we never tried either of them separate. So we don't know which one it is, so that's kind of like my last resort med. There was a med that I could take, I believe it's a sister med, another sister med to an RA med, but it was adding 2 more pills a day, and I already take so many pills during the week, during the day. I already take so many. So I went with the med that was just an infusion every 6 months. Like, that's a great place to start. The first time you get the med, you do half the dose, and you do it 2 weeks apart, and then you go every 6 months. In my case, I have such issues with nausea and dizziness, probably because it's just increasing my other symptoms, that they have to run me really slow. So when I go to get my infusion at the infectious disease center, they send me up for a 9-hour time slot. Last time I got out a little bit earlier, the time before it took the full 9 hours. I'm usually first or second patient in, and last time, because I got earlier, there was one other patient who was getting an infusion for a different med. Usually once you get to the 6-month thing, it's only like a 5-6 hour infusion with the observation hour after. But I go much longer because I can't, every certain point in time, I think in the beginning it's every hour, and then, or maybe every 2 hours, then it goes to every hour. As long as your stats are fine, they will start speeding up the med the further you go into the infusion. I can't necessarily speed it up. Last time we were able to speed it up because we did a lot of super dosing with nausea medicine. So while I was dizzy, I wasn't as bad as I normally can be. And there's another blank. My brain is not functioning well today. So what happens when I've been in bed most of the week? I'd planned on doing this way earlier in the day. By the end of the day, that's the other problem. If I'm already having an issue, like right now it's 10 o'clock at night, my brain's already toast for the day. But I think that was basically all the questions. The questions I had all overlapped. There were a few people who sent me questions on Twitter, but they overlapped. And I think that's all I have on my list. So if there's something else, I might add it on. Hopefully tomorrow. But we'll see how it goes. I've got a lot of not feeling well going on right now. So we'll see. Hopefully tomorrow I wake up and it feels a whole lot better. Because I have things to do. I get my infusion a week from Tuesday. I am going to possibly vlog a little bit throughout the day. It depends because I'm in an open room with other patients. So I have to cut music into that. I have to make sure I don't catch anybody else in it because they're obviously... Luckily, I usually sit in the corner, or I sit like right by the nurses by a window. So there's only 2 or 3 chairs, but they're all in a row. With COVID, they have half the chairs there, so we're spaced out even more. So I should be able to do it, but we'll see what happens. I think that's everything. I've said a lot because I am using it as filler because my brain isn't working. So I'm gonna go before I annoy myself with the and it probably will annoy other people.